And then I wanted to discuss the psychosocial issues a bit more in detail. Patients with substance use disorders may present with additional psychological symptoms, such as depression and anxiety, that actually might be the result of the effect of withdrawal symptoms from the drugs that they are abusing. And that is hard to distinguish from a separate coexistent psychological disorder, such as a mood disorder or a personality disorder. And these symptoms can also be associated with past childhood trauma or a combination of these possible scenarios. Childhood sexual abuse predicts substance use disorder, and childhood trauma is associated with the risk of opioid use and the likelihood of seeking buprenorphine treatment. For example, 75% of African American women who reported a past childhood physical or sexual abuse engaged in heavy drug use later in life, according to Masenko. Women with a history of sexual abuse are also more likely to develop psychological symptoms. And we have noticed actually that many patients report a diagnosis of bipolar disorder when in fact they have a personality disorder, which actually is commonly not treated. And then we hear a lot about the self-medication hypothesis that women take drugs to cope with these past childhood events or treat an undiagnosed psychological disorder. And this explanation has not much empirical evidence. Oftentimes, a childhood trauma can cause a personality disorder later in life, which is associated with drug use. And so what I'm trying to say is that the interaction between childhood trauma, psychosocial symptoms, and psychological symptoms and addiction is very complex and not completely elucidated. And I wanted to mention the prevalences that I mentioned here about the Axis 1 and Axis 2 disorders are from Grant et al. In 2004.